Okay, now the recording has started.
Yes, and oh. Okay.
It's fine.
Okay. Yes, that's fine. You can go on, Matthias, please.
Yeah, wonderful. Here on the left side, you see our hospital. This is Havelhöhe, and now we have 400 beds for 400 patients, and we have a lot of departments, and one of these department is cardiology. And I'm not a cardiologist, but I'm very closely related to this department because in the moment I have to help all colleagues and specialists to become familiar with anthroposophic approaches, the deeper understanding of the heart and hypertension and congestive heart failure and something like that. And because of this, I'm very deeply in touch with this hospital in which I have worked for more than 20 years. And this is the Goethe-Arnhem, the School of Spiritual Science. And in this building and near the building, you find the medical section. And together with Georg Soldner, I suppose you have heard him for 2 weeks or 1 week. We are leading and are responsible for the medical section. And this means for all things which are related to anthroposophic medicine all over the world. Now, and today I will speak a little bit about anthroposophic medicine and cardiology, and I will start to deepen the understanding of the heart, then to come to a deeper understanding of a special disease, congestive heart failure, and to make clear or to tell you something about anthroposophic approaches, because probably you know that congestive heart failure is even in our days a very challenging topic. And we know that even if you look at congestive heart failure without a reduction of ejection fraction, then you have the overall survival, which is in a way similar to those overall survivals of cancer diseases. It is beyond all therapies which are in the moment developed. And because of this, a lot of patients need a support, not to manage edemas and other complaints of congestive heart failure, but to ameliorate the prognosis of these heart diseases. And a small contribution in the understanding and in therapeutical hints could be via anthroposophic approaches. And to start with this, I would show you the polarity of the nerve sense system. On the one hand, the metabolic limb system, and this means the threefoldness of our human being. And if you look at the heart, then you have blood streaming from the upper parts of our human organism via the superior vena cava, and you have on the other hand the lower parts and blood streaming from these lower parts of our organism to the right atrium. And you have two streams reaching the heart, one from the nerve sense system in a way, the other one from the metabolic limb system, and they meet in the right atrium. And if you look at the quality of these different blood streams, then the upper one is coming from the brain, and the brain is an organ which is characterized by catabolism and not by an anabolic metabolism, but by catabolism. And on the other hand, if you look at the liver, then you find the life forces, the anabolism and metabolism forces in the metabolic limb system. And so you see, you have a polarity on the one hand, the nerve sense system, on the other hand, the metabolic limb system, blood streaming, venous blood streaming from the upper parts to the heart and from the lower parts to the heart, and showing us a middle position of the heart in this polarity of the threefold organism. And if you look to not only to the venous blood, but to the whole composition of fluids in the threefold organism, then you find a very important relationship to this already mentioned polarity, because you find that in the cerebrospinal fluid, you have the connection to consciousness, to the light of our thinking, to all processes of awakening of our consciousness. And if you look in the opposite to the lymph fluids, then lymph is dominated by life processes, by anabolic metabolism, and you find here the more metabolic sphere of the fluid organism, and here you have the very clear cerebrospinal fluid really related to the clarity of our thinking, of our light in our consciousness. And if you look at the venous blood, then probably you know that the venous blood is more related to the anabolic processes. If you look at the embryonic phase, then you see that all growing and developing of our organs occurs in a venous atmosphere. And so you can say, even if you look at the liver, that the venous blood is more related to the life processes. And if you look at the arterial blood, you find the development of blood pressure, and you see that according to your inner feeling, the heart increases its frequency and the blood pressure rises up. And so you see a deep connection between the soul and the arterial blood. And Rudolf Steiner has spoken for more than, or approximately 100 years, that the astral body, the soul, is related to the blood pressure. And if you are measuring the blood pressure by a patient, then this is like a window to see the inner soul, to come in touch with the inner soul of the patient. And if you have a patient which feels anxiety, then you have a higher blood pressure than if this patient falls into sleep. And you see even the circadian rhythm of sleeping and awakening from night to day. This inner rhythm of our soul is mirrored in the changing of our blood pressure. And so you can see the venous blood is more related to the etheric body, and the astral body is more related to the arterial blood and blood pressure and all these things. And in the heart, you have the middle position, which is in a way connecting the upper pole orientated to the consciousness with the lower pole orientated to the life processes of our organism. And the rhythmic functioning of the heart is in a way balancing both poles. And if you are questioning what kind of metamorphosis takes place between the life forces on the one hand and the consciousness and the light in our consciousness, then you have a very important metamorphosis, which is mentioned by Rudolf Steiner as the metamorphosis of etheric forces, of life forces, to the forces of our consciousness. And this is, probably we can deepen it later on, a very important situation that all forces we are activating in our mind are metamorphosized living life forces of our organism. And if you look at the developing brain, then you see at the very beginning in the embryonic phase the growing of our brain, but you have a sleeping state. And then during childhood, the growth of the brain is more and more stopped, and the consciousness is developed. And so you have a polarity which is well known since more than 150 years in medicine between the consciousness on the one hand and the life processes in our organism on the other hand. And a psychologist in Germany for more than 150 years approximately has written about this relationship between consciousness on the one hand and life processes on the other hand. And he has spoken about the development of consciousness, which is related to a reduction of the living properties of our organism. And if you look at several organs, then you have organs which are really needed for the development of consciousness, like our nerves and brain and something like that. And there you have a reduction of life forces. And in the opposite, if you look at the liver, then you have huge proliferative living forces, life processes, but not so much consciousness. And so you see the polarity between consciousness on the one hand and life processes on the other hand. And Rudolf Steiner has spoken about the metamorphosis, that these forces, which are in a way appearing in our organism as forces of growth, regeneration, are metamorphosized through the rhythmic system to the forces of our thinking, of our consciousness. And if you are meditating or if you are active in your mind, then you use inner forces. And if you are questioning what is the origin, where these inner forces are coming from, then we are looking to the etheric forces of our organism. And this is the etherization of our blood, the life forces on the one hand metamorphosing to the inner forces of our thinking in the upper parts in the nerve sense system. And so you have in a way a very nice mercure stuff which is built in our organism, connecting the world of our consciousness on the one hand with the world of our life forces on the other hand. And if you look at the fluids, then you have lymph fluid, which shows a lot of life forces. And you have the cerebrospinal fluid, which is really connected to our brain, and this means consciousness. And then you have the arterial blood, which is connected to our feeling, to our emotional life, and the etheric world connected to our venous blood. And the rhythmic system is balancing this pole of light on the one hand in our consciousness and life on the other hand in our in our organism. And if you are questioning in which way our heart is fixed in the organism and how it's attached in the structures or in the thoracic structure, then we have in Central Europe the term the Venus cross of the heart. It's defined or named in this way from Benninghoff, and you have the upper and the lower part of the vena cava, and you have the pulmonal veins coming from the right and left lung. And so you have, in a way, a cross, and this is the fixing point in which the heart finds its position in the thoracic space. And if you bring these both pictures together, then you have this etherization of the blood, the metamorphosis of life processes on the one hand to the light of the upper parts of the nervous system. And this is, in a way, a very important picture to understand what is really meant with the heart, because the heart, and this is for the anthroposophic understanding a really relevant fact, that the heart is not yet a pump for the blood. And because of this, I would show you some aspects, what is meant with the functioning of the heart, what is the so-called pumping activity of the heart, and what do we know about these questions about the forces which are moving the blood. And if you look at the spiritual dimension of the heart, then you have on the one hand nice terms or nice expressions in English, thinking with the heart or to learn by heart. And even in French, you find apprendre par cœur. You see that the heart is not only moving the blood, but it's connected to the inner world of our mind. And we need a certain life in our thinking, not only the informations which are related to our brain, and we are full of a lot of informations, but to bring a certain quality of warmth, of life into the thinking. And this means that we are in a way transforming our intellectual capacities to combine and bring things together to an inner, deeper understanding and life. And this means the thinking with the heart. And if you are meditating, or if you are concentrated to an inner spiritual text or verse, then you live not only in the informations, but you feel deeper with the heart. And meditating is in a way a practice to come from a thinking with a nerve sense system to a thinking with warmth and with a heart. And this is one quality. And then, of course, we can feel with the heart, and we can meet the other person. We can come in contact in a relationship to the other person with our hearts. And a very important third aspect is that we feel our conscience connected with our heart. And if you have a good conscience or a bad conscience, if you have a certain feeling which is accompanying your deeds throughout the days, then you have a certain sense organ for the inner moral quality of deeds. And this might be a hint for aspects related to our destiny, to our karma, and to further perspectives. And because of this, we know the heart, not only in relationship to the hemodynamics and other physiologic aspects, but also in his soul qualities and in his spiritual qualities. And to the spiritual qualities belong the thinking with the heart, the warmth in the thinking, the living connections, the warmth connection, the encounter with the other person, and an inner awareness, an inner awakening in the conscience, what might be perspectives of our daily deeds from the karmic viewpoint. And if you are looking not on the spiritual level, but on the soul level, then the soul and the thinking, the feeling, and the will are really connected to our heart. And probably you have heard or you have read about the 12-petaled lotus flower in the region of the heart. And it's so amazing if you look at the psychocardiology of our days and in our time, and you see what is really happening with the thinking and what is the risk factor of too much information for our heart. What is the importance of anxiety for the health of the heart? What is the importance of hope for the heart, and even of pressure in our will? Then you can say that all these 5 conditions, and if we take all these together, then it's the 6th one, are really deeply related with the health of the heart. If you have too much information and really stress in your mind, it's not very good for your heart. If you have less movement, if you have pressure in your deeds, in your will, and you have to fulfill all these things during life in a short time, then of course you have negative influences to your heart. If you feel anxiety, then we know anxiety is an independent risk factor for sudden heart death. And if you feel depressed, then this is taken to your heart and is conflicting with the heart health. And if you have no perspectives, and if you have no hope, then this is in the same way a challenging soul or psychological aspect for the heart. And so you find a 5-star of inner conditions related to the soul, which are in a way important for the health of the heart. And in anthroposophic psychocardiology, this is the basis to understand how to help patients with coronary heart disease, congestive heart failures, and others to give healing impulses out of your soul for the heart and the blood circulation. And so you get a certain instrument how to help. And you can deepen it in a spiritual way. We've spoken about meditating. We have spoken about the quality of encounter and the conscience. And you can go in the realm of the soul, and you find a lot of different exercises. And this means the 6 exercises which are related to the heart. And if you look at the German cardiology groups with patients, we have treatment groups for patients based on anthroposophic cardiology and medicine, then these 6 exercises are one instrument for helping patients with coronary heart and other heart diseases. Now, if you're going from the spiritual level, the soul level now to the physiological level, then you have a threefoldness in the functioning of the heart. And of course, we know the moving and damming function, and the damming function, which is in a way is creating a certain impedance to the bloodstream, and I will show you this in next slides. Then we have, of course, the rhythmic function and very important sense function. We know a lot of receptors, even receptors for smelling in the heart. And we know that the heart is in a way not a muscle only, but it's a sense organ, which is sensing different aspects of our organism, which has a rhythmic functioning and has a moving functioning. And so you have the nerve sense system, the rhythmic system, and the metabolic limb system. And if you look at this nice picture of the opened heart, then you have here in the atrial region more the sphere of the nerve sense system. There's not so much movement, but more the functions of sensing and perceiving and something like that. And if you are looking to the chambers of the heart, then you have the moving activity, and this is more the metabolic limb system. And so you see the polarity on the one hand of the atrial structures, and this means the nerve sense system of the heart, and the metabolic sphere, the metabolic limb system. And of course, the blood is streaming in a rhythmic way through the heart, the rhythmic system. And so you see the threefoldness of the heart, not only the threefoldness of our whole organism, but in the same way you find this main idea and concept in understanding of our organism in the small parts and even in organs like the heart. And the threefoldness of the heart we see in this picture. And if you are looking to the functioning of the heart, then you see the lancet fish and Amphibroxus. And this is a very nice fish which has no heart. And you find a bloodstream in the whole organism, but without a beating heart. And this is a very often used example that you have streaming qualities in living organism without heart. And even if you compare the vertebrate to the unvertebrate organism, then you find in this realm of organism without vertebrate streamings of fluid without hearts. And you can see that the moving is really connected to the fluids, and one has to question what is the origin of these movements coming out of the metabolic sphere. And then in the further development and phylogenesis, the heart develops, but it's a really interesting situation. And one of a very famous cardiac surgeon is Leon Manteuffel-Czöge, a Polish surgeon. He has introduced cardiology and surgery in cardiology in Poland. And he was very much interested, he was in anthroposophic medicine, he was very much interested in the functioning of the heart, because in 1920, mainly, Rudolf Steiner makes clear that the heart is not a pump. And now this surgeon was seeking what is really moving the blood if the heart is not the origin of blood streaming. And so he has done a lot of experiments, and you see all these publications for more than 50 years approximately. And one very famous result is that obviously the blood is capable to stream without the movement of the heart. This streaming is like a hydraulic ram. This is an example which is used by Steiner, but in the same way by other scientists too. And a very interesting situation is that the warmth is in a way responsible for blood streaming, and that the blood movement depends on the warmth of the organism. And these most challenging ideas are summed up in blood has its own motor energy. This is one of the results of Mantovich-Högel. Circulation is connected with the thermal condition of the subject, and mechanically the heart works like a hydraulic ram. And probably you don't know this, you can come to this later on. And then a very famous US American physiologist has mentioned this in his experiments, and he finds that there is a venous blood return to the heart, and that this is in a way a certain motor force which is not induced by the heart, but that there is a certain moving activity of the blood, and this is obviously in a way managed or induced by the demand of oxygen in the tissues. And this guidance model is very well known as venous return model. And it's really nice that even in 2017, there were new experiments which shows us the venous return from the splanchnic space to the heart during cardiopulmonary bypass surgery. Now, these are some aspects, and if you are interested in more of these phenomena, then I recommend you the book from Branko first, The Heart and Circulation, in Springer edition. And it's really interesting, the wolf-less embryonic heart and the streaming from the blood. And you see that Branko is mentioning that the heart has a function like an impedance organ, impounding in a way the bloodstream and bring it to a certain pressure, and then to lead the blood into the organism. And it's more an impeding function, not a pump function. And this is, of course, a very challenging idea, but I was very surprised that one of the main cardiac surgeons in Central Europe, Hetzer from Berlin, has written the first part and the first foreword of this book, and he was really amazed about this lot of findings, which shows us that other parts or other forces have to be acknowledged in the understanding of blood movement. And so it's really amazing that for 100 years, Rudolf Steiner spoke about the heart and refused the pump model of the heart as alone standing explication of heart functioning. And more than 100 years later, we have so many phenomena which are showing us that other forces are driving the blood than the pump activity of the heart. Now we will go to the diseases of the heart, and I have already mentioned that I will focus on the congestive heart failure. And now, for your remembering, we have the threefoldness already mentioned, and then you see the nerve sense system is related to our consciousness, and the metabolic limb system is related to movement, warmth, and even inflammation. And this is for the understanding of diseases from the anthroposophic viewpoint a very important picture, because it shows us that if you have a predominance of the nerve sense system, a certain inattention of the soul, and the soul's astral body is too active in the other parts of our body, then sclerotic diseases can occur. And if you have a lot of movement in metabolic activities, inflammatory processes, fever can develop, and you have the inflammatory pole. And so you have the sclerotic pole on the one hand related to the nerve sense system, and the metabolic pole on the other related to inflammatory processes. And if you are questioning what happens if you have congestive heart failure, then you can look at the astral body, and one of the first clinical signs of congestive heart failure is a weakness of muscles. And then you have an atrophy of the muscles, and you see the inner moving part, or the inner astral body, and the activity is not so much related to the limb system, but detached in a way from the limb system. And because all these ideas are very important from the viewpoint how to help patients, because we have then to question how to bring back these members which are not working in the physiologic sense. And you can see, and this is shown by the red arrows, that the astral body is detached from the metabolic limb system. And you see the edemas on the one hand, you see the atrophy of muscles on the other hand, the weaknesses in the metabolic system, all very well-known symptoms of congestive heart failure. And you can say you have a certain detachment, a certain release of the astral body, and which is separated from the metabolic limb system. And of course, on the other hand, if you are recommending movement and physical exercise, then this has a very important healing effect on patients with congestive heart failure. Probably you remember that for 40 years, it was really forbidden for patients with congestive heart failure to move. And now we are convinced that the opposite is the right recommendation, that moving is in a way healing, or is in a way ameliorating healing properties in the organism of a congestive heart failure patient. And so you see, you have on the one hand the detachment, the separation from the astral body, from the out of the limb system, and you need, on the other hand, the reincarnation, the reconnection of the, of the astral body with the metabolic limb system. And on the other hand, if the astral body is separated from the moving and metabolic functions, then a predominance of the nerve sense system occurs, and you see then that sclerotic tendencies are developed in the organism. And all patients with congestive heart failure have a certain tendency to sclerotic complaints. And probably liver cirrhosis if you have a long-standing congestive heart failure, and probably that you have a certain clotting tendency in the blood if you have congestive heart failure. And you see in the lungs and in the spleen and even in the kidneys all the tendency of collagens and sclerotic tissues and the hardening of the organism. And so you have on the one hand, and this is for my opinion and for my understanding of the congestive heart failure, a very important one, you have the separation of the astral body, which needs moving to heal. The separation of the astral organism from the metabolic limb system. And on the other hand, you have too much hardening forces, too much predominance of the nerve sense system. And this is mentioned in this sentence: the astral body withdraws from the metabolic limb system and acts congesting and hardening from the nerve sense system. And if you are questioned what is the inner, not the outer aspect, but the inner aspect from the viewpoint of the higher members, from the astral body, then you have this situation in a dynamic understanding of the congestive heart failure. And if you have such a diagnosis, then you get ideas how to help, because you have to bring back the astral body in the physiologic functioning of the metabolic limb system, and you have to release the hardening functioning of the nerve sense system. And if you are interested in which way the nerve sense system can harden the organism, then this is a nice study with subjects which were exposed to mental stress. And this is the period of mental stress. And if you look at changes in blood flow and something like that, even in diameters of blood vessels, then you see stress and consciousness is related to constriction, vasoconstriction. And you can see vasoconstriction means too much working of the nerve sense system. Dilatation, on the other hand, occurs if you have the metabolic limb system, if you have muscle activity and certain increase of blood flow in the muscles. So this is another picture where you can see the hardening tendency. If you have too much the working of the nerve sense system, then you find the arteriosclerotic signs and alterations in the blood vessels. And this nerve sense system, the linkage between our consciousness and our heart, is in the same way documented for the life. And if you have in childhood traumatic experiences, then we know that these challenging situations where you have too much consciousness in probably early childhood, this has consequences for later parts, later phases of the life. And now we know, and this is a very, very new study, that childhood adverse experiences and stress are linked with an impairment of endothelial function and with the beginning, we can say, of coronary heart disease. And if you look at the description given by Steiner about Waldorf education, then you see that he has mentioned that traumatic experiences are in a way influencing the health of the later life. But this is not law which without exceptions, because we can help. And all pedagogical educational programs and even remedies and anthroposophic medical approaches can help, that this linkage is not the destiny of the life, but it's influenced by helping activities of doctors and pedagogics. Now, if you are interested to bring the soul more in a deep connection to the body, then you need warmth. And a very important warmth application is oil dispersion bathing. And this is warm water bathing with etheric essential oils of different plants. And you can improve, if you use probably rosemary, you can improve warmth organism of the patient. And this means via warmth, the higher members, the eye and the astral body are more connected and incarnated in the etheric and physical body. And this is the inner meaning of oil dispersion bathing with essential oils. And if you are looking what we know in normal scientific terms, then we see that body weight and heart rate and systolic blood pressure, diastolic blood pressure, fasting plasma glucose is ameliorated by the application of warmth. And it's really amazing that I show you this picture, you can see it easier, that sauna bathing is inversely related to cardiac death and even all-cause mortality. And if the so-called Finnish sauna study about approximately about 22 years, and if you would have one sauna per week, then during the follow-up time, this is the risk to die. And if you have 2 to 3 sauna applications during the week, then the risk is lowered. And if you have 4 to 7, then you are always in the sauna. Then the risk is in a way really low. And even the duration of sauna shows us the same situation. And you see the very important hint, which is from the anthroposophic understanding so useful, that warmth is a healing element. You need warmth for the spiritual development, you need warmth for the soul, and you need warmth for the body in helping patients with congestive heart failure. Now, a very interesting and important remedy for congestive heart failure, blood pressure, and all disturbances of our rhythmic system is cardiodoron. And there you have unopordon on the one hand. I will show you some slides more. And this is deeply related to the nerve sense system. You have hyoscyamus related to a rhythmic system, and primula veris, this nice plant with a lot of life forces in this plant, is related to the metabolic limb system. And cardiodoron is a remedy which regulates the functioning of the higher members, not antagonizes or blocks or something like that, but is regulating the working of the higher members and harmonizing the working of the higher members in the organism. And we have already some results from some studies in improvement of heart rate variability, blood pressure regulation, and even the improvement of sleep quality. And it's so amazing that if you have the possibility to reinforce healing forces in the rhythmic system, then this is not only related to cardiac arrhythmias or the rhythmic functioning of the heart, but of the whole rhythmic system of the patient. And I have some patients which are so happy that they can sleep in a better way if they are taking cardiodeuron. And of course, they know that this remedy is given to help in the cardiologic situation, but they feel the improvement of the sleep. And day and night, day is more related to our active life. Night is more related to the inner healing properties. We are healing during sleeping and night. And now you can read it, but it's not necessary. Here are some studies which are done with cardiodeuron and rota. Even the last one from 2021 is very important and shows the improvement of cardiovascular and other symptoms, and sleep disturbances are mentioned too via the treatment with cardiodeuron. And so cardiodeuron, for my opinion and clinical experience, it's a really helpful remedy which is needed for a lot of patients with rhythmic disturbances. And if you are looking at these nice plants, this is Onopordon. I have already shown this picture. And all these plants have a certain quality that they are inhibiting the converting angiotensin converting enzyme. And so you see these plants are, if you look from the physiologic aspect and you take some extracts from these plants, then you find these properties. But in the composition of cardiodeuron, it's more the process and not the substantial effects. But it's really interesting to see that these plants have, in a way, cardiologic functions, and that it's a really wise composition to bring these three plants together. All these 6 plants you see here have ACE inhibiting functions. And if you look at medical plants with more than 50% ACE inhibition, then this is our plant, 80%. It's really a lot, which is possible to achieve with this plant. And then Primula veris. This is a very helpful plant full of etheric processes. And this is one study which shows us the healing properties, the cardiologic healing properties of this plant composed in cardiodeuron. And you see that you have one situation which is related to Onopordon, and this means activities which are related to the nervous system. And then you have in this lovely plant, Primula veris, the increasing etheric situation, the healing properties which are so needed in patients with congestive heart failure. And then this is really worthy of note. You see Strophanthus in this picture, and then Digitalis purpurea in the other picture. And now we know that all substances, uabain and even glycosides, we find these substances in our body. And now we know that cardiotonic steroids are found in our body, and we find G-Strophantin, G-uabain in our body, and we find glycosides like Digitalis purpurea in our body. It is synthesized in the body out of cholesterol. And because of this, you see that we have in our human organism substances which are directly related to the outer world. The healing plants for heart diseases are directly related to substances which we can find in our organism. And Rudolf Steiner has mentioned that in the same time, the heart was developed in phylogenesis. In nature, digitalis purpurea occurs. And so you see a very deep connection between heart plants, healing heart plants on the one hand, and then the heart diseases in our human life. And now you can see different remedies, very helpful from Velida, Oleum strophanthi capsules. You can take it until 4 times 2 capsules, or you can choose the remedy by Vala. And these are very helpful remedies if you have problems with congestion, with hardening, with a certain elevated resistance and endothelial dysfunctioning and something like that. Then you can use this Oleum strophanthi. And if you have to improve the moving activity, then you can use bitter substances, because bitter substances are capable to bring the astral body in the organism and to help to reinforce the dynamic forces in our organism. And there we have digitalis purpurea D2, and you can choose 3 times 20 drops. And these are 2 plants which are used in combination with cardiodoron, I have mentioned. And then, of course, Hawthorn crataegus is so important. It's one of the very, very important plants which are capable to heal, to reinforce healing forces. As I remember, Hawthorn has a certain antioxidative property and can counteract the catabolic situations in the human organism and can help to regenerate, to bring all higher members in a healing situation in case of congestive heart failure. And so you have a very famous remedy, crataegus 45 milligram from Schwabe and Hawthorn drops from Velida. And this is in a way a really non-toxic approach to the patient with congestive heart failure. And then bryophyllum. You know this remedy probably, or have heard in the seminar about this plant. And bryophyllum is containing magnesium. And we know that magnesia is related to the etheric body. I will show you some aspects about this. And we have heard that the congestive heart failure is characterized by an overwhelming astral activity, and you have to reinforce, like primula veris, the etheric world. And for this, you can use bryophyllum calanthiopinata. And bryophyllum is reinforcing the etheric situation and calming the astral one. And if you have patients with a certain astral anxiety and a certain stress experience, something like that, with too much astral activity, then you can use bryophyllum and you will see some calming down and a certain quietness in the soul, which is achievable by bryophyllum. And if you are looking of the effects which are known, what is achieved by bryophyllum, then we know a blood pressure lowering is an high antihypertensive efficacy. Since more than 7 years, we know this. And if you have patients with red blood pressure, and the red face and the inner tension in the soul, then you can use bryophyllum. It's a really nice remedy together with cardiodeuron to help patients to cool down or to cover certain calmness in the inner soul, to a certain quietness in a way. And then we know, but this is more the topic for diabetes patient, a lowering of blood sugar and very interesting anti-nociceptive properties are well known. And so bryophyllum in such patients I have characterized, if they have pain diseases or chronic pain symptoms and something like that, then you can use bryophyllum too. And a very important situation is magnesia. And magnesia is one of the very famous remedies. This is only a nice picture of bryophyllum showing the life processes at the margin of the leaves with the new generation of new bryophyllum plants. And you see with your eyes the etheric predominance of this plant. And now you can get an impression how to help patients if they need a reinforcement of the etheric situation. And bryophyllum 50% is a very often used remedy 3 times a day. Hypericum auricultum is very often used in patients with congestive heart failure because we know that patients with congestive heart failure suffers oftentimes from depression. And we have to be aware that this is not only a disease of the heart, it's the disease of the whole organism. And this means in the same way a disease of the soul. And we have to be aware about depression accompanying congestive heart failure. And if you find a certain depressive mood in the soul of these patients, then you can use Hypericum. St. John's word is this, Hypericum auricultum, and this means the inner connection with the metal, gold, and St. John's word. And both together in a special pharmaceutical process are the basis of Hypericum auricultum. And I have really beautiful experiences if we are using these remedies, Hypericum auricultum together with cardiodeuron. And I have one patient who suffers from a very, very severe congestive heart failure and coronary heart disease and something like that, diabetes too. And he was not an antipositivist, not at all. But after taking these 2 remedies, cardiodeuron, Hypericum auricultum, the situation was completely changed. And he was so thankful about this medication in addition to other remedies too. This is, I have to skip these slides. Colchicum is very interesting now in the after myocardial infarction. And I have chosen the slides because colchicum is a very famous remedy in anthroposophic medicine, even for thyroid patients. But in this case, we know more and more that colchicum is useful in coronary heart disease. And okay, this, if you are interested, we can speak about this later on. Now, a very important topic. I have mentioned the warmth, which is so important for congestive heart failure.
Matthias,
yeah.
We usually make a pause of 10 minutes after 1 hour. So
okay.
It's the question if it's also good for you.
Yes, of course, please. Yes, excuse me. I'm so engaged in showing you all these situations. Then we will make a pause and we will see us in 10 minutes, isn't it?
Yes, and the reason is that people can be much better concentration if they have 10 minutes.
Yeah, then have a nice break, cup of coffee or nice things, and we will see us in 10 minutes, right?
Yes, in Israel it's 6:22, please. Okay.
6:22.
Well,
okay.
in Germany it's 5:22.
Yeah, okay.
5:23. Okay.
Yeah. Okay.
Okay.
See you.
Sorry for
Thank you so much.
Okay. Matthias, I wrote you in the chat. You saw what I wrote you in the chat. If it would be possible to leave some
yes,
20 minutes.
Yes.
20 minutes for questions.
Yes. Okay, then I will shorten this. Okay.
But we can finish before 6, 6:15 if it's if you finish the lecture. So
yeah, fine.
Okay.
And Miron, the participants know something about higher members and threefoldness, or it's...
Of course, I wrote you, yes.
Yeah.
Yeah, I think you spoke in the right level of the knowledge, so...
Yeah, okay, because if I don't see the faces and it's...
Yes.
One is not so in touch with the others.
Yes. So, okay, times in Israel is not times in Europe. It's another dimension.
Yeah.
Sorry for that.
Yura, fine, nice to see you again. Sarina.
Hello.
Hello.
Sorry, I missed the first half, but here I am now.
Yeah.
Okay, Matthias, maybe we can just start.
Yes, of course.
Join.
Yes, I will show you only the last slides, and then we can have an exchange to all what you will like or you are interested in. And I have ended before our break with mistletoe, and you know, of course, that mistletoe is used in anthroposophic oncology, and it's so important, for my opinion, to know that we have non-oncologic indications for mistletoe, and we have an indication of mistletoe in cardiology. And if you are looking at this nice picture about the fruits of the mistletoe and then the snow, this is not very often seen in Israel, I suppose, but in Europe, it's even difficult to see snow in the same situation. But you see that mistletoe bears its fruits during wintertime. And if you look at wintertime, at the snow time and coldness, then you have the sclerotic tendency in nature. And now you have the warmth activity, the warmth of the fruits and the sulfur pole of the plants, which is in a way working against these coldness and hardening forces in nature. And so you find the warmth quality of mistletoe as a certain remedy against the hardening, sclerotic, and in a way winter quality if you have sclerotic diseases. And so we use mistletoe oftentimes in patients with congestive heart failure and coronary heart disease, and I've done it so much in my life, and it's really important to make experiences with this, that it could be really helpful to improve the inner situation from patients with congestive heart failure. And I have written in the Merkurstab a short article about non-oncologic indication of mistletoe, and even in the metabolic sphere of sclerotic diseases, congestive heart failure, in rheumatology, in pain treatment, in neurology, in the treatment of dementia, and all these things. And I think we should know the whole spectrum, which is worthy of note in a therapeutical sense if we use mistletoe. And here you have this nice picture. These are the dewdrops in the morning, the living forces in the morning. And this is in a way crystallized in wintertime in the forming forces in snow crystals. These are both water drops. Here you have the dewdrop in the morning, and here you have the crystallized situation, the hardening, forming properties of wintertime and coldness. And in this situation of structured water, where the mercury element is in a way hardened and structured, then you find the fruits of the mistletoe and the sulfur pole, which is in a way in opposition to the coldness of the snow crystals in the wintertime. And so we know a lot, but I only will show you that mistletoe is capable to improve the nitrogen element in our body, and nitrogen is the element which is releasing and detaching the astral body from the etheric one. And if we have oxygen, you have the incarnating air quality. And if you have nitrogen, you have the losing, not the losing, the detachment and the separation, like fall in sleep. It's the same situation. And if you use nitrogen spray during coronary heart attacks, and if you do it too much, then you see that the blood pressure is lowered and that there's a certain tiredness which occurs, and which shows us that the astral body is leaving the etheric and physical body. And in the opposite, oxygen is incarnating. No, this is only to underline the situation which we use as mistletoe therapy in cardiology. And then copper is really important for the congestive heart failure. If you have too much hardening, too much constriction, if you have a endothelial dysfunction, if the breathing of the arteries is disturbed, and if you have the hardening of endothelial structures, then you can use the copper to widen the soul, to widen the astral body, and to widen the arteries. And this is in a way the physiologic perspective of copper. And we have cuprum aceticum D4, or the very famous ampule from Vala. And really a nice remedy is Melissa coproculta if you have patients which feel a certain inner anxiety, and this leads to a tension in the soul. Then you can use Melissa coproculta, and you have a helpful situation, because you have learned in the seminar already probably that metals are very closely related to the eye organization, and plants are more related to the astral one. And if you have metals, even in combination with plants, and this is Melissa coproculta, then you can bring both higher members together and in a healthy working in the organism. Then, of course, you need iron. And iron is really well known in congestive heart failure. If you have iron deficiency, then even in school medicine, you use iron substitution to improve the heart situation. And iron incarnates. The copper is in a way widening the estral organization. The ferrum is incarnating the estral organization and the eye organization. And if you have an exhausted or even tired patient, then you can use Levico comp, or a very nice remedy is ferrum hydroxidatum. It's a recommendation given by Rudolf Steiner, not in this indication, but as a pharmaceutical production, ferrum hydroxidatum 5% or even 50%. And gold, of course, is the central element. The heart is the sun of our human organism, and the metal of the sun is gold. And you can use the Cardiodorus comp aurum or the already mentioned Hypericum auricultum. And then I would like to highlight magnesia. And if you look at the green of the leaves, then in all these green leaves is magnesia. And magnesia is really related to the life processes. And if you inflame the magnesia, then you find a light, which is from the spectral components the same like the light of the sun. And so you have the sunlight in the magnesia and the connection to the life processes. And you can say magnesia is capable as a process, not as a molecular substance, but as in his processes, is capable to reinforce the anabolic working in the higher of the higher members in the night, in the etheric realm. And like the sun is, and the sunlight light is transformed to the life of the plants, the higher members are in a way transformed in an anabolic working in the etheric level of our organism. And probably you know we have 24 grams magnesia in our body, much more than iron and other metals. And we have a lot of magnesia in the bones and of course in other tissues too. And magnesia has a lot of effects and can lower the blood pressure and can ameliorate the vascular stiffness and even insulin resistance. And it's really a very important remedy, and we use it in bryophyllum 50%, and in a way in the encountering with the life processes of the plant, and of course in Cardiodorus comp magnesium, it's another magnesia containing remedy. Yes, this is for nutrition, but I think the time is really over, and it shows us that nutrition is really important even for cardiac patients. And if you have whole grain consumption, and then it's really a good approach in nutrition. And then I would really like to show you the significance of art. And this is a really important study which shows us that art is associated with an improvement of overall survival. And because of this, this is one study which shows us that art is not only nice for the soul, but in my terms, essential for the body and for the health, because this art can reduce mortality. And this is one picture of this study. If you have no receptive art contacts, then this is in a way the proportion of survival, and this is the 50 years, 60 years old participants. And if you have 91 and he has no art contact, then this is the surviving proportion. If this person has frequent art contacts, then the overall surviving is much better. And for my opinion, it's the first study which shows an association, not a causality, but an association between life expectancy and overall survival and art, and underlines that art is a therapy, a therapeutical approach, not only a nice situation. And art is the soul of nature and of the whole cosmos, and we participate in this soul by experiencing what is colored. We have an encounter with the soul of the cosmos if we are seeing the colors in our surrounding in nature. And this is the threefoldness, a drawing given by Rudolf Steiner according to the colors, and you have in the middle the green color and then the light. We have spoken about the light at the beginning of our lecture, and then the darkness of the lower parts. And if you look at the level of consciousness, then you have, of course, the consciousness in your nerve sense system, and this means the light. And if you are looking inwardly to your liver and stomach and bowels, then you have no possibility to develop consciousness. There is a certain darkness from the perspective of consciousness. And so you have a wonderful colored threefoldness, and this threefoldness can be used for therapeutical approaches. If we have sclerotic tendencies in the middle system, rhythmic system, metabolic limb system, we have to bring red color, the warmth into the picture, and we have to seek for some paintings and series of paintings in which we have at the very beginning the starting point, and this is an image mostly of the inner situation of the patient, and then we have to bring the warmth in the hardened organism, red colors and others. This is the zodiac. We have no time for this, and a very nice connection to the blue window of the Goetheana, where you find the forming forces related to the blue color. And then very important therapy. And if you are questioning what is really important for congestive heart failure patients, then we need the R veneration on the one hand, and the love, E, and the hope, U. These are the inner vowels for warming the thoracic space and the middle space of the patient, and bring warmth into the rhythmic system in a way. And if you are combining these vowels, R, O, U, with L and M, then you have, and this is the gesture of these hands, then you have the encounter and an inner breathing. And L and M are the breathing consonants, which brings the soul from the hardening and from the dominance of the nerve sense system in a healthy breathing. Because if we will heal patient, then we have to improve the breathing system, the inner relationship between outer world and inner world. And then some patients are really interested in meditations, and we have spoken at the very beginning about meditation and the healing forces of meditation, because it should be clear that meditation on the one hand can widen the soul and can lead to a new light for our consciousness, for our new perspectives and something like that. But if you look at the etheric level, then you can see that meditating improves the etheric organization. And we know so many effects of the inner meditative life related to the healing forces. And it's really touching for me that Rudolf Steiner has recommended a lot of meditations for patients, even at the beginning of the anthroposophic medicine in the 20th years of the last century. And there we have completely other situation in the normal medicine of this time. Now we are practicing meditating in different kinds, a lot in medicine, integrative and mind-body aspects. But the very beginning was given for anthroposophic medicine by Rudolf Steiner to re-improve and reinforce the etheric forces, because we have started with this Mercury stuff and we have linked the thinking on the one hand with the life forces on the other hand. And now you see the relationship between the thinking and the inner meditative activity to the healing forces. It's in a way based on this metamorphosis of etheric forces to our inner forces in our soul and mind. And one very important meditation I would like to end with is this sun meditation given by Rudolf Steiner. And it is relating the heart to the sun and helping patients to come in a healthy relationship to this light of the sun, which can re-improve the healthy qualities. And for my opinion, if you are questioning what is the therapeutic approach to help patients with congestive heart failure, then we have, of course, remedies in which we do a certain intervention. If we choose diuretics or ACE inhibitors or something like that, then we are using, in a way, remedies in an interventional aspect, because if you stop this, then the organism is the same, it's not changed. It's not a healing property, but a helpful property to overcome some symptoms. And then we have spoken about a lot of remedies to help patients with congestive heart failure, about the art therapies, the eurythmy therapy, and now the inner approach in which patients are capable to reinforce their inner healing properties. I will read it now. When I look into the sun, its light speaks radiantly to me of the spirit that full of grace through world existence works. Sun, you bearer of radiance, the power of your light on matter conjures life from out of earth, immeasurably rich depth. When I feel into my heart, the spirit speaks its own word of the human being that it loves through times and all eternity. Heart, you bearer of the soul, the spirit power of your light conjures life out of human being, immeasurably deep inwardness. I can see, looking upward to the sun's bright orb, the mighty world heart. I can feel, looking inward to the heart's warm life, the ensouled human sun. Now, these are some ideas to anthroposophic approaches in cardiology. And now we have more than 20 minutes. I was asked for 20 minutes to come into an exchange and you can post your question or to clarify some aspects what you are interested in.
I have two questions, if it's okay. One is, if you can just, you said it in few sentences, but clarify a little bit more how the anthroposophical therapeutics are putting to use together with the conventional treatments for the congestive heart failures, like you said, diuretics or ACE inhibitors, beta blockers, and like how do you use the two, or how do you do it? The other question is more about like in a occult physiology kind of matter, in the way of how the heart is connected with the cardiovascular system and the blood in the term of the human organism, because it is like one system. Yeah, it's not just the heart. So how does it connect in the spiritual sense? Thank you.
Now, the first question was the combination or normal school medicines on the one hand and anthroposophic approaches and remedies on the other hand. And I will give you one example. For some times ago, I have had a patient with hypertension, and he was a musician. And now from the cardiologist was recommended to take beta blockers. And then he came with a beta blocker medication, and in a way the blood pressure was controlled, and he feels in certain inhibition of his creative musical forces. And now he has had the question, probably I need the beta blocker, but what can I do in other terms? And then we have spoken about the cardiodorone and biofilm and other remedies. I'm not remember all in the moment, but I have explained to him that we can see how to reinforce the healing properties and how we can probably reduce the beta blocker medications. And if there is a really change in lifestyle, if the soul is capable to breathe in a healthy way, and if you use the biofilm and other remedies, then you can reduce or even avoid other remedies. But in our times, if patients come to me, they have from other doctors a lot of remedies, and 3 or 4 and something like that. And it's not very helpful to say stop it all and you take now cardiodorone, and you have to make clear what is this meaning of beta blockers, and this is symptom control in a way, and what is the meaning of the other remedies, and this is reinforcing healing powers. And if we have made these two perspectives clear, then a lot of patients are very satisfied that they take their beta blockers, but have the inner hope to get a new inner health, supported by arts, by eurythmy, by inner way and path, and by other remedies, of course. And then they feel they are on a way, and the way it might be possible to reduce other remedies, and otherwise to have them as a certain second part, but that an inner development is possible. And if you look at the Dean Ornish, do you know the name Dean Ornish? Yeah.
Yeah. Yeah, I know, but I don't recall what. Yeah,
this is so nice because he was a cardiologist, I think, San Francisco, and for, I think, 30 years in Lancet. He published a study in which he has compared the conventional medication with a second possibility consisting in nutrition and walking and meditating. And then I remember after 3 months, a lot of symptoms and complaints were reduced in the second group. And after 2 years, there was done a certain re-evaluation with angiographic examinations, and there could be seen a certain remission of atherosclerotic findings. And so it's really amazing that we have a very important second way of healing, and not only the school medical situation, but we have, for my opinion, I practice this in this way, we have to see what is really needed on the one hand and what you can bring not only in a certain, how shall I say, in a certain inhibition, because these ACE other inhibitors are in a way inhibiting the power of the disease, and probably it's really needed. But then you can question, patients have the question how to transform the power of the disease in a healing property. And then they are seeking for other situations. And of course, they feel that these remedies are doing something with them. And so I think you can do a lot for patients with other remedies. Even if you have congestive heart failure patients, you need, on one hand, some school remedies, but you can add in a very meaningful way, and patients which are really thankful for this, you can add anthroposophic remedies and therapeutical approaches too. And there is one picture, and Peter Mattison has used these pictures oftentimes. If you have a person in water which is unable to swim, then you need a rescue activity, of course. And on the other hand, a teaching course, how can I learn swimming, is even needed. But you need both. And in situation where you need a certain intervention to bring the person out of the water, then it's not very nice to say that you can learn in 10 weeks swimming, because this is really not a very nice recommendation. But you have to have an intervention on the one hand, and on the other hand, you can start a healing, a learning procedure. And this picture is very nice to make clear what is in a way helpful on the interventional basis and what is needed for the evolutionary aspect of healing. And this was your first question. I hope it's a little bit helpful for you. And the second was the heart in the blood system. I have understood that. And there, for my opinion, you have a gesture in the heart, and this is in a way, there are chambers and there are congestive qualities, and the streaming of the heart is brought to a certain quietness through the contraction, systolic contraction, and even the moving blood coming to the heart is in a way stopped in the heart. And if you look at the capillaries in the periphery, then you have the life forces and in a way the living properties of the blood. And from the last month in the life of Rudolf Steiner, we know a description of him that he spoke that the moving of the blood from the periphery to the heart is the same as a certain process of dying. And this is really amazing that the blood comes in a way to an end. The moving stops and hardening occurs in the systolic pressure and something like that. The living forces are in a way reduced. It's a certain kind of dying. And in this time, if something is dying, then the spiritual being is in a way occurring, like in the moment of death. You have the dying body, and then you have the inner birth of the mind. And because of this, you can say, if the blood is streaming from the heart to the periphery, it's a way of incarnation. And the inner world is, the higher members are brought into the life and the etheric sphere. If the blood returns from the periphery, from the living sphere and realms in our organism to the heart, then you have a certain dying process with detachment or with a certain inner birth of our mind. And this means a breathing between the center on the one hand and the periphery, the incarnation in the life situations of the higher member, and in a way the inner light which occurs in the heart, and the outer signs for this birth of light in our heart region is the pressure and the dying of the blood. And it's really amazing. If you look to the erythrocytes, then you have, I think, 250 billion cells each day, approximately each day, produced in the bone marrow. And if they are entering the bloodstream, then they are losing their core and nucleus, and they are losing the life. And you see the living sphere of the bone marrow is in a way transformed in a death process in which erythrocytes are losing their nucleus, and a certain quality of death occurs. And so you find a lot of different phenomena which are showing us that the living situation, the blood is in the sphere of life, in the periphery, and then comes to a certain hardening and death process in the heart. And this means inner liberty and inner birth of our mind. And this is in a way the breathing between center and periphery, between heart and the capillaries.
I would say, maybe if no one else has questions, how is it related to the eye, like to the eye which is manifested in the blood in this process?
Yes, I think you have different connections of the eye in relationship to the blood. Because if you look at the whole threefoldness, then you have a certain eye representation in the brain, and this is the frontal brain, because there you are responsible of your own personality. Then you have a very deep connection of the eye with the liver. And if you have patients with liver diseases, then you feel a certain weakness in the will. And there you see that the eye organization is in a way related in the metabolic system with the liver. And then you have the heart in the middle system. And if you are looking the will aspect of the heart and of the eye organization. If the eye organization is really active in the warmth and the living processes of the blood, then you have more the periphery. And if you have the inner occurrence, the inner birth of the eye organization, then for my understanding, it's more related to the heart. And this is the breathing of the eye organization in the middle system in the blood, more leading to an incarnation, to a connection with the body. And this is the blood streaming from the lungs through the heart into the periphery. And then you have the opposite situation, the backstreaming blood from the periphery to the heart, and even then the expiration, the exhalation, and this means the separation of the higher members from the organism. And so you have in the middle these both situations which are for the lungs explained in the inspiration and expiration, in the incarnation of the higher members using the arterial blood to the periphery, and the excarnation in the streaming, in the venous blood streaming to the heart. And so I think it's a different connection, more incarnated arterial situation, more excarnated in the venous and backstreaming quality of the blood towards the heart. Do you have other questions?
I have a small practical question. Because I usually use much lower doses, 10 to 15 drops. And are you usually using 20 drops or sometime 10 and sometime 20?
Yes, if you have very patients with obesity and metabolic constitutions, then I use higher dosages. And if there are neurasthenic constitutions, then you can lower the drops. And if you have a lot of doctors in your hospital, then I'm so happy if they learn something about cardiodorol and know some dosage or one recommendation concerning the dosage, and not a very broad spectrum of different approaches. But mainly I use 15 to 20 drops, yes.
And do you use rhythmic massage with Aurum lavandula also?
Yeah. I think this ointment, Aurum lavandula comp, is a very important one, and a lot of patients love this ointment and the application in the heart region. And even if you have patients who have at the following day heart examination, angiography, or something like that, and they feel inner anxiety, then it's so nice that they sleep better if they use this ointment, Aurum lavandula comp. And for a lot of patients with inner anxiety and which feel a certain inner tension, this ointment is very helpful because they can smell the lavandula and feel a little bit relaxed. And the aurum, the gold, is capable to reinforce the eye organization.
And the rose?
The rose. The rose is not a plant which shows us aspects of other healing plants. Excuse me. I will show you a short picture for this. If you have a healing plant, then you have the leaves, and of course the roots, and then the flower. And this is the threefoldness of the plant. And if we have spoken about Hypericum, then we have the predominance of the flower. And if you have Bryophyllum, then you have a lot life processes in this region. And then, of course, we have other plants like Mandragora or others in which we find a predominance of the roots. And so you can say, if a healing plant is capable to influence a disbalanced threefoldness in the human organism, then you have a certain predominance of one of the system in the threefoldness of the plant. And this is characterizing the normal healing plant. But if you have roses, then you have a total harmonized threefoldness of the plant. And because of this, the roses are showing the patient a healthy model how to be and how to harmonize and balance the threefoldness. This is the inner gesture of roses, the roses. And because of this, you can say roses are in a way the gold in the realms of plant. And so you have the gold, the essential oil of roses, because the essential oil is a warmth substance. And then you have another essential oil, lavandula, and this is capable to harmonize the astral body and to bring the astral body away from inner anxiety.
Dr. Gielke,
Yeah.
can I ask you, what will be the anthroposophical explanation for some heart defects that we see in a newborn, like ASD, VSD, transposition of great vessels, and so on?
Yeah.
And in the adult, what will be the explanation for arrhythmias?
Oh yeah, it's a very interesting and important question. I think one is what might be the origin for ASD and VSD and other malformations in the heart. And for my opinion, it's how the higher members are in a way incarnated and can form the organ as their structure or as their instrument. And if you look in phylogenesis, then it's so amazing that the septum is not developed in frogs. And you have, of course, a differentiation between the arterial and the venous blood in a way, but without a septum, in intraventricular septum. And at the stage of reptiles, then the septum is built, and you can see forms follows function. And you have a normal functioning, and then the anatomical form is developed. And for my opinion, there must be a certain hindering or a certain situation which is not in a way or in which the eye is not in this way capable to form the function, the really functional heart with septum and something like that. And of course, you can question what is the difference between the ASD and the VSD. And for my opinion, the ASD is more related to the nerves and system, and the atrial region is more related to this, and the VSD is more related to the metabolic system I have shown. And then if you compare that, symmetry in a way is related to our eye experience, and that we have a certain symmetry in our organization, which we use to become aware of our eye presence, because we have two eyes and we can look to our surrounding. And if we look all things in our surrounding periphery, we are aware of ourselves. And so we need the symmetry, which is mainly related to the nervous system, for the consciousness of our own self. And so I think disturbances of symmetry and bilateral symmetries are in a way probably related to this inner functioning of the eye organization and the forming forces due to the eye organization, or which are developed by the eye organization. And if you are questioning about rhythmic disturbances, then all rhythmic disturbances are in a way caused by a disbalance in the threefoldness. And we should be aware that rhythmic disturbances are not in disease by their own, but there are consequences of a disbalancing in the threefold organism. And so if you look at atrial fibrillation or something like that, you probably know that congestive heart failure is oftentimes related with atrial fibrillation, and the other way around, atrial fibrillation can lead to congestive heart failure. And so you can see atrial fibrillation is a certain blindness of the heart, a certain predominance of the hardening forces of the nervous system. Because of this, you need coagulation remedies against warfarin or Marcumar or others to counteract the predominance of the sclerotic forces. And then you have a certain changing in the composition of the heart, and remodeling of the heart. And this contains a certain hardening of the heart. And you see, even if you look at atrial fibrillation, then you have a linkage to the disbalanced threefoldness. And because of this, one should give some recommendations, like to move and to bring warmth in all these situations. And the Finnish sauna study has shown that even sudden heart death, and this is a rhythmic heart death, is reduced if patients are using sauna. And so we have some remedies and even ablative procedures which can counteract the rhythmic disorder, but we have to reframe this atrial fibrillation, other rhythmic disorders, for the background of the whole threefoldness of the human being, and to see that these rhythmic disorders are linked to a predominance of the nervous system. We have to see what about the soul and the inner life of the soul, and how the soul and the inner being is connected with the limbs and the metabolic limb system. And so we have to reframe a little bit the cardiac rhythmologic disorders.
Thank you very much.
Thank you,
Wonderful.
Amir. Thank you, Amir. And I think it's time to finish and to go to make sauna.
Yes, you can do it. Yeah.
And I would like, before we shall separate from Matthias, I would like to ask the participant to stay for 5 minutes. So I would like to mention something that I haven't mentioned in the beginning. That's Dr. Gierke is a specialist in internal medicine and also in palliative medicine. And he wrote a textbook, which, okay, it's opposite here, but it's the name is Internal Medicine, Foundations and Therapeutic Concepts of Anthroposophic Medicine, which, as far as I know, it's a kind of textbook for anthroposophic medicine in internal medicine. So I recommend it very much. And I think we've just tasted a bit from you, Matthias, and I hope very much we can meet not in a virtual, not virtually, and we still keep the opportunity to visit and to meet you in the Havel Hoe. And I want to thank you very much for this wonderful and clear lecture about congestive heart failure.
Yeah.
So thank you. Thank you very much.
Thank you
Thank
all.
you.
It's so nice to
Thank
see
you
you.
very
and-
much.
Very much.
Yeah.
Thank you.
And
Thank
all
you
the
very
best.
much.
And probably we can see us in person, probably in Israel. I'm not quite sure. We'll see what happens in the future. But in the same way, you are very warm invited to the Goetheanum, if possible. In Switzerland, all restrictions are stopped, as I have heard, at the 17th of February, and we hope that we can have our annual conference in Dornach in September, and you find all further information on our website. And if you are interested in, then you are very warm welcome to visit Goetheanum and us in the Goetheanum. And of course, we will think about visitation in Havelhöhe, and that you can come to us in the Academy of Anthroposophic Medicine and our hospital. And you are very welcome to visit us in different locations. So all the best to you, and yeah, bye-bye.
Bye-bye.